Welcome back. Welcome back. You are listening to Whissel Weekends here on AM 1170. The Answer. My name is Kyle Whissel, your host with Whissel Realty Group. Joined as always by Mr. Jason Hall with Team Home Loans. And Jason, this is probably the most special episode we've ever done.
You know, it is. It's definitely probably number one. I mean, I'm thinking of a few. We had that scary guy come on that did those haunted houses that people literally...
McCamey Manor.
That was crazy.
Especially when he showed up in the no-window van. Yeah.
Parked downstairs on a Saturday night.
Yeah, that was a little creepy. I was going to say a name before the van. You guys can probably fill in that blank, but it was creepy.
It was creepy, but both times you're anxious, you're excited, but this one you're excited, but you're nervous. So you've got your wife with you here, Brittany Whissel.
So she can hold my hand.
She can hold your hand. She's been through Botox. You've got Dr. Roher, close personal friend.
Yeah, so Dr. Alex Roher runs SD Botox here in town, and we're both part of a networking organization together, and Alex has stepped up to shoot me full of needles in my face.
All right, so how long is this going to take, Dr. Roher?
The procedure will probably take about a minute, and I'm not rushing. It's just, that's the nature of the procedure.
That's how quick.
That's like LASIK surgery, right? It's like one of those things. There's this big buildup, and then it's like 1 minute, and you're done.
Mm-hmm. I'm thinking something on that. Get all excited 1 minute, you're done. Wonder what that sounds like, right, Kyle? Anyways, I'm not
weirdo.
I'm a weirdo.
You're a weirdo, Jason.
But you know what? This is exciting. So I get to call play-by-play. Producer Todd could tell how excited and nervous you are. He's laughing. Look at the big grin he's got in there. Yeah, we're having some fun here, but we're gonna do this.
So, Alex, walk us through what we're gonna do first, and then we'll just let you get after it.
Okay, so I've already drawn up the Botox. It's in this syringe right here. Place it right in front of Kyle, just so you can get acquainted with it. And then I'm just gonna put on some gloves. I'm gonna use alcohol swab to clean off your forehead and your the side of your eyes there, the crow's feet area. And then I'm just going to place the Botox into your forehead.
Let's do it, man.
All right, Dr. Roher, you can take off your headset. All right, so we have live here. You can watch this on YouTube. You can watch on the Whissel Facebook page. You can see what I'm seeing. The video is going to be out there. We'll have it out there in a few days. And Dr. Roher literally is putting on blue rubber gloves, getting ready to put into Kyle Whissel the needle. Producer Todd has come out of the box to witness this because we're all curious. How does Botox done? And we're videoing it and putting it in there. And you could see your blood rushing, man. Calm down. This needs to help, Kyle.
I got giant veins, dude.
You do got some giant veins. He's got some excitement. So Dr. Roher has taken the needle out. He's getting ready, making sure there's no air bubbles in there apparently. And we're going to see this happen. So again, this is Whissel Weekend. It's normally a real estate show, but we are talking Botox. And next segment, we will go into real estate.
Have Botox, right?
And again, right. Kyle Whissel, the number one real estate team in San Diego.
So I'm just going to be injecting.
All right. Now. So here we go. He's putting the needle right in, nice and smooth. Puts it in there. Dr. Roher live in studio with Kyle Whissel, injecting the Botox. And he's put them at different spots. He does this multiple times a day. And he says it literally only takes a minute.
Gotta be a little bit nervous, Kyle.
Yeah, because
he's never done such a celebrity before.
Yeah, it's a celebrity. You're on live. It's kind of cool. I want to be quiet, but I can't be quiet because I'm live.
You gotta be talking.
This is different. I'm seeing some, little excitement, little bumps on Kyle's head as these are getting put in.
You can actually see when he's injecting, you can see it raises up.
Normal. Everyone who gets Botox looks like that.
Okay, I believe you, and we'll talk about it here. I know you're almost done.
Raise your eyebrows one more time.
So again, you're listening to Whissel Weekend, AM 1170. The Answer. Kyle Whissel, the host for over 5 years. Myself, the co-host, Jason Hall. Kyle, one of the top real estate agents in all of San Diego, and his team, again, the number one team in San Diego per transactions. Kyle actually has a personal friend, Dr. Roher, in here, giving him Botox live on the radio. And we're looking to do about 30 injections. I think he's in about 15 would be my guess at this point.
You only have one more to go, Kyle.
One more, he's saying. And Kyle, he's a little nervous, but he's excited. And the first time ever, his lovely wife, Brittany Whissel, in studio with us to see this magic moment, because Kyle has teased her for years about doing Botox, giving her a hard time. and Kyle is getting it done. So he's on the side of the eyes there, which they refer to as crow's feet. And this helps with the wrinkles. Wow.
That's it.
So what did it feel like, Kyle?
Felt like a needle getting stuck in my forehead. That's what it felt like.
Just like a normal needle, though, right? Because you had nothing, so we don't have any.
Yeah, that is about as painless as could be. It's always a little nervous when there's a needle going in your face, but yeah, I mean, it's just like a little prick. It's nothing like one of those big needles that they stick into your arm when you get blood drawn or anything. It's just a tiny little needle, so
yeah,
that's not bad at all.
Not bad.
It's fun when you hear the juice like shooting into your face.
You actually heard it.
Yeah, the juice or the Botox. You can literally hear it as it's going up under your skin.
All right, so you put it. Tell us exactly where roughly you put it, Dr. Roher, so that everybody listening knows, and everybody listening on video or watching us on video knows where you put it.
So I placed it throughout his forehead. That was the number one area that we wanted to take care of with Kyle, and so we placed about 20 units, like 10 needle sticks, maybe 12, throughout the forehead, and then there were some left over, so we placed them on the side of the eyes and the crow's feet. So now he has a couple little bumps, and that's completely normal. Everyone does. They last about 20, 30 minutes, and then they'll be gone. And then I wish Botox had a little more instant gratification, but it takes about 3-4 days to see the benefits. So that's when it kicks in, 1 week full effect. It'll last about 3-4 months. And as it's kicking in, Kyle's going to notice he could still raise his eyebrows, but to a slightly less degree. So fun thing to do is just to take raise your eyebrows every morning and take a selfie, and then do it today, do it tomorrow, do it,
and then see how that disappears,
and see how those lines really fade. Yeah.
You can do a little time lapse of your wrinkles going away.
Now remind us all, what does I know you talked about it in the first segment or second segment, Botox. What is that, and what is that doing right now as it's in one of my closest friends' face, and I'm seeing bumps? What is that stuff doing?
Jason's like freaking out.
Well, it's just
Why
different,
are there bumps
right?
on your face?
Yeah. I'm like, did you get bitten?
Yeah, so it's just, right now it's setting in, spreading out, and it's just going to block the nerve from telling the muscle to contract a little bit. And so, like I said, he'll still be able to raise his eyebrows. Would be weird if he can't. Too much Botox in that muscle can even lower the eyebrows. You never want to do that because, women particularly love arches. They love very open eyes, and you wouldn't want to rob them of that. But men too. It looks, no one wants to walk around with their eyes feeling heavy. So, so it's just kind of taking effect right now, or beginning to, and then soon it'll just decrease the function of that muscle a little bit.
Okay. Now, you said it's going to take a couple days for it to really fully, be all in there, because it moves around. Am I hearing that? I mean, how does the drug work?
Yeah. So I mean, if you want to get all scientific and geeky about it, it prevents the release of that neurotransmitter, acetylcholine. And so there's some stored acetylcholine that, is already made before all this.
Right.
So
that's in his system.
Once he goes through that.
Okay.
He won't be able to make more for a couple months, and then that's when he won't be able to raise his eyebrows to quite the same degree.
Okay.
Still be able to raise them, but those wrinkles, I'm sure Kyle loves them, but
they're like a part of who I am.
They
all
are.
This gray hair, these wrinkles,
they
like that makes me Kyle.
You want to be perfect in every way, I guess, Kyle.
Yeah.
But sometimes we're not always perfect, but we try to look better, and definitely, it's a big thing for the ladies. But how long does this last?
It'll last about 3-4 months.
Wow.
So we do the two big things people do: Botox and dermal fillers. And Botox tends to last about 3-4 months, and fillers last about a year.
So Alex, talk about where are your shops at in San Diego?
Okay, so we have 3 locations. The biggest one is in Pacific Beach, right on Grand Avenue. There's a giant sign. And then the first one was in Hillcrest. We still have that one. And that one was just grew, and so we just couldn't fit everyone anymore. So we built a second one just a couple of miles away in Mission Hills. So right on the 5 in Washington.
I love it. Again, you're listening to Whissel Weekends, AM 1170, The Answer. We're talking with Alex Roher, owner of SD Botox. So you've got one in PB, one in Hillcrest, one in Mission Hills.
Correct.
So you do Botox.
Yeah, we do Botox.
You do filler.
We do filler.
What else?
So we do a bunch of stuff. We do all kinds of lasers. So we do cool sculpting, which is a machine that kills fat cells completely non-invasively. I'm sure there's TV commercials, et cetera, now, and it's really a cool procedure. We do hydrofacials. We do all the things beauty. So microneedling, whatever you could think of, whatever you want to look a little better, you have a little something you love yourself, but you want tweaked a little bit, we can help you out with that.
I love it. If somebody wants to connect with you, shoot us a text and we'll send you over all the info for 'em. 619-663-SELL, 619-663-SELL. We'll shoot you over all of Alex's contact info. Before, we got a couple minutes left in the show, but what's the difference between filler and Botox?
So that's a good question. I get it all the time. So we talked about Botox. What it does is just partially paralyzes the muscles responsible for wrinkles. Filler, on the other hand, think of it as collagen. So we're just injecting collagen in certain areas to either make something bigger, the classic example, and everyone thinks automatically of all those like overdone, overfilled lips. But I mean, for every one of those lips you see, there's probably 30 tastefully done, subtle, nice looking lips. So a few practitioners like to go a little overboard, and a few patients like that. But overall, so filler, it just fills. It could either make something bigger like the lips, or it could fill lines. Like, for example, the line between Kyle's nose and his mouth, that's called his smile lines or nasolabial folds. So that'll be next show. But,
He's already just picking my face.
Yeah. I can already see the bumps are going away. So when you put that needle in, I think all of our bodies react a little bit different. But you said it would go away in 20, 30 minutes, and I already see them disappearing. So that's kind of cool. And that was only, 5 minutes?
Yeah.
Some of them are starting to go away on Kyle.
Yeah, exactly. So they'll fade. Sometimes patients don't want their significant others knowing what they're done. And if they're really close, I just tell them to take the long way home, and they'll never be none the wiser.
So, Kyle, if people want to see this on video, what we just did, and they were missing us live, where do they go?
All right, we will have this up since Facebook and Instagram have both been acting up today. We will have it up on the Whissel Weekends YouTube page. Today, we're recording this on Wednesday. If you're listening on the air, you're hearing this on Saturday. So by the time Saturday rolls around, we will have this on the Whissel Weekends page.
Okay.
So you guys can go on the YouTube Whissel Weekends page, and you'll be able to see the video of Alex sticking needles in my face.
And will we have maybe the contact information for Dr. Roher?
Yeah, and if you want to get in contact with Alex, again, best thing is give us a call or shoot us a text. We'll get you connected with them. 619-663-SELL, 619-663-7355, and we'll make that introduction for you guys. But honestly, if you've been considering it, like if you've been freaking out that it's going to hurt and all that stuff.
Wasn't bad, huh?
It's nothing. Like, it's easier than a shot, I would say. I mean, it's just quick little pricks.
You didn't even move. Yeah, you literally did move. So that worked out good.
Weird.
So coming up for our last segment of the show is the Whissel Podcast, where we talk real estate, the Whissel Way. It's the Whissel Way Podcast. Dr. Roher, appreciate you having in. Brittany Whissel, the young, lovely wife of Kyle, and Penelope Purpose, which is a rescue farm for the pigs, and it's amazing. So looking forward to the next segment here, the Whissel Way. Thanks for tuning in. We'll be back next Saturday.